All right, folks, so yesterday and when we were at a daily huddle, our spotlight data showed that our rate for doing diabetic foot exams was down to 50%. So when we drilled down further on that, we found that we were missing our new diabetic patients. That, you know, we really were not aware that they were diabetic before their appointment.
In fact, when we review our diabetic foot reminder compliance for the past month, we were only at 85% compliance.
Okay, this is great. How about we share some best practice ideas for approaching this concern?
Well, I think we have a really good process in place for identifying the current diabetic patients with our pre-planning process, and also when we identify them at the morning huddle, because I have my health sheet and I know who I should be aware of. But for some of our new patients, sometimes I know they're diabetic when I look at their outside records, or maybe when I talk to them on the phone. But sometimes I don't know. So that for me is the challenge. How do we identify our new diabetic patients if we can't get that information through records or a phone call?
That's a great point. Sometimes I discover this during the appointment from talking with the patient.
Often the patient is quickly heading for the door to leave. And if we don't know you diagnose them as diabetic, then we'll miss our opportunity to complete the diabetic reminders because we typically don't see them after they see you.
That's right. We definitely have an opportunity to improve this before the patient leaves. If I discover a patient is diabetic during my visit, I could bring the patient to your office, Karen.
Could you send Karen and I an instant message so that we are both aware? Then if Karen is busy with another patient, then I could take care of the diabetic foot exam and whatever additional diabetes education is needed.